Last but not least, move to the last region, to the East Netherlands. Rijnstate is the healthcare organization from this region. So the webinar will be on 26 June from 2 to 3 p.m. So sorry for the mistake that you can see in the slide, but it will be from 2 to 3. And now let's give the floor to Luz, that will be presenting both the challenge and solutions, since the representative from Rijnstate was not able to join us today. So Luz, the floor is yours.
Thank you. My name is Luz Habermeel, and I'm a project manager at the Innovation and Healthcare Transformation Department of Rijnstate. One correction, the webinar next week is from 3 till 4 p.m. Then the first challenge is DigiCare Aware. What we are searching for is to create more awareness of telemonitoring and the virtual care center, which is the department of nurses who perform the telemonitoring, so remote patient monitoring. And we really want to activate healthcare professionals to be able to further scale up the telemonitoring. So this challenge is all about how can we motivate a large group of healthcare professionals. As I said, the goal is to scale up telemonitoring so that we can monitor more patients from home, and so that it is also used by more healthcare professionals. So we are already scaling up in the form of more and more patient populations. So this challenge is really about within the healthcare paths that we already have, how can we further scale up the telemonitoring? So we want a solution that creates awareness and activates healthcare professionals, taking into account their high workload, different roles, and different knowledge levels and digital skills. So we're not looking for a new technical solution because we already have that, but we're really looking how to accomplish the cultural change to digital healthcare. Bureau straks cannot join this webinar, so I will explain the solution and what we're still searching for. What Bureau straks is already going to do is finding a way to make the healthcare professionals more enthusiastic to provide digital healthcare and to really change their behavior in such a way so that we can reach our goal. How they're going to do that is they're going to create several creative sessions to research what are the success factors, to make strength weakness analysis, and to also create a list of ideas from the healthcare professionals on how we can increase the number of patients within the telemonitoring. So the result of this solution is a program of solutions to further scale up the telemonitoring, which we will create and then also implement. But right now we don't really know what kind of solutions it will be, because we still have to go through the creative sessions. And it will also include a wish list of communication tools to support the program of solutions that we will have designed together. So what we're still looking for in a follower SME is a design company who can design communication tools and materials that support the creative program. So we're looking for expertise within change communication, expertise of user experience, and a very broad range of design skills, digital design skills, because right now we don't really know specifically what kind of designs we need. So we're looking for a very flexible and innovative company. And just to be clear, we're looking for a design company and not really a communication company, because the content will be created by the leading SME, so Bureau straks together with Rijnstate. Yeah, so that's it.
Okay. Thank you very much, Luz, for the details and information provided on the challenge and solution. So let's move to the next challenge, Delcy's challenge.
The next challenge DELSIS stands for determine the extent of lifestyle supports to increase self-management. So we are looking for a solution, some kind of triage tool to determine what extent of lifestyle support a patient needs based on their specific needs and based on their level of self-management. So we want to further increase self-management of patients so that we can meet the increasing demand of care, so to make the healthcare more future-proof. We already have various methods of lifestyle support, and also we're also already creating an automated advice on the content of the lifestyle support. So what we want in this challenge is really a process step before that. So a triage to determine what extent of lifestyle support a patient needs. So, for example, that can be only a referral to an informative website or to some options in the region for lifestyle support. But it can also range to a full-on coaching program because a patient really needs a lifestyle coach or maybe a doctor or a nurse to support their lifestyle. And this, we want to do that to deploy the support effectively and to make sure that we use the capacity of the lifestyle coaches and the nurses and physicians to give the content of the lifestyle support, and not to use them to do a triage that we might also be able to do automatically. And then Mike from HealthChain will explain what solution they have and what we're still looking for in that follow SME.
Yeah. Thank you, Luz. My name is Mike. I'm the founder of HealthChain, based in the Netherlands. And with HealthChain, our mission is to have a positive impact on the lifestyle of people. So unfortunately, a healthy lifestyle is not the default lifestyle for most people. And our mission is to make impact on that, a positive impact. So change behavior by making the healthy choice the most attractive one. Obviously by rewarding the healthy choice, also by challenging and giving insight. As Luz already said, the main objective of this challenge is to determine the amount of support one needs to work on a healthy lifestyle. And what we provide as a leading SME is a tool in which a questionnaire is loaded, in which a triage outcome is made based upon the answers given by the patients. And this is a mix of business rules and AI that is used to come to these outcomes. So this will be presented to the lifestyle professional of Rijnstate Hospital, and he or she gives the final go on the triage. So the challenge we are facing is to make impact, a positive impact on the health of patients. And we're looking for a company to support us in 3 different tasks. So these are different tasks, possibly not by one SME, but I'll briefly introduce them. One of them is to boost the patient engagement to fill in questionnaires. So most people, do not like filling in questionnaires, especially when they do not see the need for it. But how can we motivate patients to use the questionnaire and to use the triage tool, the lifestyle assessment tool, to do this? So this is a big topic. So maybe some marketing expertise is needed here. The second challenge is the way to adapt the lifestyle assessment tool to cultural differences. So, for example, the product of the follower SME should be concrete advice to adapt the tool and the content of the questionnaire to people with different cultural backgrounds in order to make the most impact to make it smooth, adjusted to the cultural background. And the last one is the market exploration of these type of triage tools, AI-based. So what is the market in Europe? What can we learn from the implementation of these type of solutions, and how can we incorporate them in the lifestyle assessment tool? So this is sums it up. Thanks for your attention.